let me rephrase that. I'm sorry. 100% of the vaccine wash is not fully effective. So that means if I inject 100 people, one, if you will, maybe not quite one, will get the virus of one of the three that are inside the flu shot. Now, why is that? Because what you're doing is when you inject somebody with the flu shot, we take the assumption that it's a dead virus. So sometimes the doctors or specialists will say, well, it's impossible to get the flu shot from the flu from the flu shot because it's a dead or attenuated virus. And that's not true, because a small, very small, but a small percentage of those people that get the flu shot actually are given the flu, because a few of those viruses will survive the chemical scrubbing and therefore actually develop the flu. So you get some people that say, man, I got the flu shot and I immediately got the flu. And the reality is the flu shot gave them the flu. The other problem we're seeing is this: we see this epidemic is, in the news, and it's fear and it's scare, and it can be scary because, again, nobody wants to get the flu, and certainly nobody wants to die from the flu. But the majority of people, well into the 90% or high 80% of the people that are coming down with this epidemic flu are actually already got the flu shot. So you've got a huge number of people that already got the flu shot that are coming down with the flu, yet the news and the media and the public is talking to everybody about getting a shot, and we get into that effectiveness. One of the complications that we get into from the flu shot is the efficacy. And what the heck does that mean? How effective is the flu shot? The problem that we have is the science uses the production of the antibodies. Now, we talked about it earlier. The antibodies actually have been shown, even though they can be produced as a result of the flu shot, are a very poor indicator now of whether or not the inoculation or the flu shot actually prevents you from getting the flu. So that's to look at. But the reality is, what we'll look at is the scientist will say, listen, I'm going to take 10 people or 1,000 people. I'm going to give them a shot of this flu shot. And then weeks later, they're going to come back, and I'm going to look to see if they made antibodies to the 3 specific strains of virus that I injected them with. And lo and behold, they did, and 90+% actually produced it, a high 90%. So the efficacy of the shot is 90-something%. That's what you'll read sometimes, but that's not accurate. What that means is the efficacy of the shot was 90-some-odd% in producing antibodies. But when so that's what the drug companies, if you will, or the propaganda wants you to hear. They want you to hear that, right? But when you step back and you say, listen, I'm going to work on hospital workers, or I'm going to look at a population study, especially in Canada, and I'm going to inject 1 million people with the flu shot, and 1 million people are not going to get the shot, and I'm going to follow each group around to see which one is more likely to get the flu shot. We see that the people that didn't get the flu shot got the flu no more often than those that got the shot. So the government of Canada and the experts of Canada came out a couple of years ago and said the shot was no more effective than a sugar pill. Also, if you read the research, those people that have, all the people that were worried about getting the shot to prevent the flu that have other health challenges like asthma, if you will, or pneumonia, or breathing problems, diabetics, people with autoimmune diseases, and so forth, we're finding out that there's a higher rate of hospitalizations to those people that have those challenges than those people that don't. So if I have asthma, I'm more likely to be hospitalized following the flu shot than I would be if I got the flu naturally or did not get the shot at all. So it goes totally against, 100% goes against what you're seeing on the news. And it is so frustrating. And I think one of the reasons we get so upset and it's so frustrating is that there's such an emotional connection between what you want to do for yourself or your child, and you want to do the best thing, and you think you're doing the right thing, and you don't know who to believe, and you hear all these different stories out there. Who is the person that I should believe the most? Who is the most trustworthy person? And I think, unfortunately, when it comes down to it, you have to look at yourself and you have to say, listen, in the end, I'm responsible for me, nobody else. So in listening to this, I don't want you to do it because I said one way or the other. I want you to look within yourself. I want you to do some research, whether it's on the internet or read a few books. I want you to actually do your own research. You ultimately have to decide whether not to do it or to do it. I will say, one of the things that my dad always taught me, and I certainly carry with me, is is what you do in the best interest of others? Do you put the interest of others first above your own? So the bottom line is, listen, we all got to go to work. We all got to make a living. There's nothing wrong. You know, I work in healthcare. There's nothing wrong with going to work and helping people and getting paid for it. But is what I do is what I do in the interest of them? Have I put their interest ahead of my own always first? That's the question to ask yourself. And I think when we look at these immunizations and companies that are coming out, I think what they're doing is they're more concerned about making a buck, and they're more concerned about making sure that, you know, they can create enough of a propaganda machine, or enough misinformation, or enough statistical manipulation to leverage their product on people. And it's all in the incentive to make their dollar first before their concern comes down to you or I as people. And that's the frustrating part. You know, if a company is going to come out with something and they do their own research and find out that it's dangerous, then why in the world would you ever put that drug out there? But when we look at a simple drug like Vioxx, you look at Merck Industry knew through their own private research that that drug was dangerous, killed more people than the Vietnam War, and yet nobody talks about it. They paid a hefty fine, and that was the end of it. And in reality, we have to start holding them accountable, but first we got to start holding ourselves accountable and saying, look, rather than lining up out of store because they're giving out a free flu shot, or it's only going to cost me $5, before we do that, what we should do is step back, do a little bit of our own research, and say, hey, is this drug safe, and is it effective? And when we look at the influenza shot, we can look at all of them, but let's look at the influenza for today's commentary. The reality is, it is not safe. It is not safe for you or your child. And I can sum it up. If I gave you a glass of water and said, look, there's a little bit of mercury in here, go ahead and give it to your daughter, you would never do that. Then why in the world would you take that same amount of mercury or more and inject it in your child? If I gave you a glass of water and said, look, there's a whole bunch of MSG, there's a whole bunch of formaldehyde, there's a whole bunch of phenol. Imagine if you went to your sink and you started drawing water out of there, and you went in and have it tested, and it had phenol or MSG, or it had antibiotics in it, or it had formaldehyde in it, or mercury in it, or aluminum. You'd freak out. You'd go to the newspaper, you'd go to the government, you'd yell and scream and say, look, at the municipal water supply has toxic chemicals in the water that I'm giving my child. Yet we line up to get these toxic chemicals injected in us without understanding that they're in there, the dangers of it, or the permanent effect that they can have on my children. And that's really where it comes down to. And then we get down to the effectiveness of it. It's not effective. So I talk to so many people, so many patients of mine, and they say, geez, I have to do something. Well, I understand that, and I'm not telling you not to do anything. Make sure that your nervous system's healthy. Make sure that your immune system's as healthy as it can. Certainly wash your hands. Absolutely. Eat better. Keep your immune system as high as you can. And God forbid, if you get the flu, understand that the majority of people, as awful as it is, that may die from influenza or the effects of influenza and so forth, remember that they're dying primarily from the dehydration, not from the infection. People are dying from being dehydrated. So you go through a severe bout of vomiting or diarrhea. And that's what needs to be, if you will, treated. That's where we need to make sure that we're attending to the needs of a young child or a senior and so forth, to make sure that their fluids stay up, or they will go into a renal failure or some other challenge. But the idea that the shot in some way is going to prevent that, never been shown. The CDC did a long-term population study and showed that there was no drop in the mortality rate of seniors that had the shot versus those that didn't. So this whole idea that, geez, we want to give seniors the shot because they're less likely to die, in reality, we found out that, geez, all the seniors getting a shot versus those that didn't, there was no higher degree of mortality in either group. So the point is, the shot's ineffective, and it's not safe, and it's something that we really should look at severely, significantly, critically, and say, why is it then that this is being done? Who are the powers that be that are promoting it or forcing this upon us? And that is where the bubble needs to be cracked. That approach towards the health and healing of our own children. especially our children, has to be looked at with severe critical thinking, and people need to start standing up and say, look, these things are not safe, they're not effective. Not only am I not going to give it to my child, after you do your own research, don't just listen to me, look it up, do your own research, then the reality is I'm not going to give it to my children, I'm not going to take it, and you know what? I got to start questioning who's forcing it upon us and start holding these drug companies accountable, because what you'll see is they've spent millions and millions, tens to more of millions of dollars and paying out for lawsuits as a result of the side effect of these shots. And it's scary. Controversial topic. Thanks for bearing with it, through it. I mean, there's so much science and there's so much stuff that I could read over and give it to you, but I think the reality is you got enough to digest. And remember, guys, that your health is your responsibility. Don't listen to me on the internet and take that as gospel. Read, learn, and remember, in the end, you have to be accountable for yourself. And when you start to do so, I think you'll be led to the truth in a much faster, ethical, and honorable way, rather than relying on some of these authoritative so-called individuals who unfortunately have the interests of themselves or others ahead of your own, and that's where we've gone wrong. This has been Dr. Joe Borio with Change Your Health, Change Your Life. Remember, eat well, exercise, sleep well, water. Wash your hands, I guess, in this time of flu season. Make sure that you, your mother, your father, your grandfather, your uncle, your cousin, and everybody you know is under regular chiropractic care to make sure that the brain messages can talk to the body, keeping your immune system healthy through this flu season. Guys, have a great week. I'll talk to you soon. Thank you.